epidemiology, childhood obesity. Now, his work often addresses critical nutrition initiatives and has previously headed the School of Public Health Remarks. Now, with a round of applause, please make welcome
by substantive DVC, Michael Michel, Professor. I'm honored to be before you, and our professors within. I'm also so honored to be before you, my Professor Waudo, Professor Kimiwe, Professor Juliana, and many others, Professor, we have so many, and Madam Veronica, my counterpart from the Ministry of Health. I'm very happy that today she's here, and she's very much at the head of nutrition programming in the country, so you're lucky to have her. I want to start by saying that cancer, the theory behind it is student mentorship, correct? And it started with one, I can call him one boy, but now he's a Mr. Molo from KU, and he struggled to begin to bring together all the nutritionists who are learning currently so that they can share some scientific and professional activities. So cancer is not just KU. KU is a national office, but we have 90 chapters in every training institution, universities and college. So every university must have an association chapter with a secretary, a chairman, and also a treasurer. And they have not done it yet, but we expect them also to meet every year as delegates. So all those officials are supposed to convene at Kndi so that they can have their own delegate conference. So right now we have 90 institutions, which means we have how many delegates? It's 90 times 3. And each college and university have a patron. The patron is forwarded by the principal, the CEOs, and vice chancellors. So that is the structure of cancer, and the work is purely professional. Now, when we come like this, we normally support them, the professionals who are senior, and also the regulator, so that we give them visibility. So if you see NTV, the members of Fourth Estate, MTV is here, and KBC, it's because at 1 or by 7 today, they should be on air, indicating what they are supposed to do. And are you still former president or you are president? You have graduated from KU. So when are we getting the next president? He is a standing president for cancer because he's also the founder. You know, when you're founding something, you have to stay there for a while. So our SOP also indicates that he will remain. Other offices will change except the one for the president. Thank you very much. Let me introduce myself. I think you got my previous CV, and I'll be very brief. My name is Dr. David Okeyo, and I'm a PhD holder, though I have 4 degrees, including post-PhD, MPH. I've published over 56, let me put it like that, and 6 books now. I've supervised 5 PhDs to graduation. I've supervised 29 today, masters. One is just about to graduate here in KU. And now, with that, I am, you said it well, I'm the winner for Young Scientists, Junior Scientists 2014 for Africa. And now, I'm also the winner on Leadership Excellence coming in March in Africa. So, one of the things that the board reviewers, the jury board that was reviewing my work for that leadership said is the mentorship component. And some of the videos with the cancer contributed towards that. So we really need to strengthen this process. So the leadership award is not for me only, it's for all of us, including universities. And we did invite the vice chancellors, when a DVC, to come and join us. I think Professor Kumu is aware that you should come. Just come to Safari Park. A seat is going for 40,000 for that dinner. Can you clap? Now, the science. Now that I have my colleague Veronica here and we are pushing nutrition together, Veronica is a member of the council for Kndi, and we are also members of the State Department for Public Health in the Ministry of Health. She knows me as a pusher, and I know her as an inquirer. When trouble comes, she always calls, and we say, how would we work on this together? And she has just told me she's ready also to support cancer in one way or another. She works with, if you want to clap better than that. And she has said that she also works with NGOs, many of them in technical working group, and I want to believe scaling up nutrition. So she's a good link for your mentorship program. And the cancer team don't only target sponsors, but you can also look at support from the ministry so that you can do well. Okay? Now, in my topic, I have chosen the triple burden of malnutrition, the context of economic, social, and political problems. And I want to start by saying that nutrition is political in nature. It is just as good as the politics of malaria. And if anybody is dreaming that you will have zero malnutrition, forget. So we can start from there. So when we talk of eradicating malnutrition, it is not there. We can only say reducing malnutrition, because definitely malnutrition will be created. And it will be created because of our systems, including facilities that we go to. So you may struggle here, but when you reach the facility, then you start finding things that lower the integrity of dietary intake. And I want to give you a good example. Just recently, I was sharing with the CS, Cabinet Secretary, a plate of an anemic dinner, typical anemic dinner, at one of the level 6 facilities. It was ugali and cabbage. And that was it for that night. And that means that many people who went to the hospital came out sick, more sick than they went. And therefore, you can't eradicate malnutrition. But it is our efforts to reduce malnutrition. So the state of food security and nutrition in the world indicates between 2020 to 2021, we had 46 million more hungry people. That is in the report. And 3.1 billion people of the world population. Does it bother us? Kenya is part of it. And these people could not afford healthy food in 2020, while 670 million will still be struggling with hunger in 2030. So the projection is that we are going to have hunger issues up to 2030. We are in 2026, and this is FAO report 2025. So do you still want to say that we want to eradicate malnutrition? We will be daydreaming, and we have to be honest to one another. It's only efforts that can help us. It is clear evidence that inequality is increasing, and particularly when the rural women suffer. The greatest change agent on matters of nutrition cannot miss the rural woman. I know men are struggling to be part of nutrition, but the woman in the house is the key. And a study that was done sometimes back indicated that out of 18 roles that any family can do, women do 18, while men only do 9. So the workload is too high for the women, yet they are the contributor towards matters of food. So the triple burden of malnutrition in the era of globalization refers to the coexistence, you know that, of undernutrition characterized by stunting, wasting, and underweight, students, underweight. With micronutrient deficiencies, normally we describe that as hidden hunger, and overnutrition, which is obesity and overweight. Now, it is very clear on your thematic area for today. Now, the main recognized underlying global cause of each element of the triple burden of malnutrition include but not limited to poverty, 1, lack of access to most nourishing foods, poor diet choices. Now, when we talk of poor diet choices, it means that what we consume, including you and me, are not healthy at all. And if you are in doubt, review your 24-hour record since yesterday. What did you eat? This is the time that even nutritionists themselves have Coke and biscuits at lunchtime. And they are comfortable with it. And they're comfortable with it, correct? Coke and biscuits. We also have a problem with food supply value chain. And those things have made it very difficult for us to deal with triple burden of malnutrition. Now, I want to come to the Kenyan situation. That is global. It is a problem across many countries. Now, in the global, I did mention to you that it would be interesting to know that out of 124 of 145 countries, we have multiple forms of malnutrition, which is the triple burden. And 41 million global deaths are attributable to triple burden of malnutrition. Now, in the Kenyan context, the situation of triple burden of malnutrition is worse, though we are making efforts. There is no doubt that Kenya is experiencing triple burden of malnutrition, characterized by undernutrition, hidden hunger, and overnutrition. And the first thing I want to say, the last time we had micronutrient deficiency study is what it was in 2011. And those are how many years now? 14 years. So what do we use as our reference? And you still see most of us are quoting the document. Now, in our analysis of that document, we realized that most data were incoherent. And we found out that it was purely data that was cooked. And we raised it up with those who studied it. It means we don't have any tangible data that we can say this is the status of micronutrient deficiency in the country. That is something that the researchers need to do, the professors, the doctors, and then of course we also must engage our students to be part of it. Now, we also know that even though reports indicate Kenya is making progress regarding reducing rates of undernutrition and obesity, there seems to be increasing obesity among women and of course children, which is a high risk. This is led by major public health crisis that we have in the country. What does it tell us? That nutrition therefore becomes a public health matter. And that is why we are in the State Department for Public Health and Professional Standards. Child malnutrition alone causes annual gross loss of approximately 373.9 billion, which is equivalent of 3.1 billion, roughly equivalent to 6.9 of GDP for Kenya. So which means we are losing more when we don't tackle malnutrition, the triple burden. A situation that should worry both countries, the country and the national government and the county government. If you review the KDHS, which is recent, 2022, you will see that chronic malnutrition, which is stunting, is 18%. Now, if you look at ASAL areas, they are far much above the national average. Now, you'll find most of the interventions target ASAL areas. But I want to tell you one thing about that. It is not about helping the country. It is about how much can I earn from the program. So we are not solving the problem of malnutrition, but we are solving the problem of our pockets. If I'm given a consultant to go and do, once I get my per diem and I collect money, I don't care about the outcome of the program. And any evaluation of the program that seems to be negative, we attempt to reject, even if they are the truth. And that is a big problem in nutrition. We also know that if you leave out obesity, we have underweight at 10%, which is a measure of acute hunger. It means that we are still far from meeting the interest of Kenyans. Now, if this is the situation that we want to deal with as professionals, we need to know that there is the politics of the triple burden of malnutrition. And as I said, that politics of malaria is the same as politics of nutrition. You can't eradicate malaria because the next question is that who is directing malaria research, for example? Have you ever heard of London School of Africa? No. The malaria is controlled by London School of Tropical Medicine. And an attempt to eradicate malaria completely by bringing chemicals was thwarted because of that, because research has to continue with malaria. The same to politics of HIV. It will not end, yet we can end it. So, politics of triple burden of malnutrition. Triple burden of malnutrition is critically contested matter in politics among 88% of worldwide countries. So not only Kenya. This whole political system stems from dysfunctional food systems driven by corporate interest, which have led to high rates of NCDs and slowdown in achieving zero hunger. Now, the interest that we have with international communities, the power struggle, and also who carries the shot, will still make us continue in the same state if it is not corrected. Now, I've just said that food systems is key. So it is not the diet, but a complex system where we have food from all value chain, starting from the field to fork. Dysfunctional systems which produce poor quality diet, policies of the burdening of malnutrition is common across many countries. Kenya, not left out. Corporate influence resulting in power dynamics in food policy among corporations is also very critical. For example, unethical marketing of breast milk substitute. Yes, we know that substitutes are critical for critical cases, but then over-marketing to influence the mother who is supposed to breastfeed for 6 months exclusively is unethical. And overproduction of ultra-processed foods. Let me give you an example. If you go to the supermarket today and get pick and peel orange, it tells you pure orange, correct? And you pick it and take it to your house and keep it and drink. Now tell me which country can produce enough oranges that can form the quantities of pick and peel we have in the market. Remember, one supermarket can have thousands of liters. Which country has grown that kind of orange? So what is composed in pick and peel is purely chemical mixtures. That is not food. Because food is something you take, it nourishes with nutrients, it does not cause harm. So probably the NCDs are coming now. I came up with a suggestion some times back, which was taken by World Bank in my absence. It was my idea. And I said, why don't we then introduce taxes on sugar-sweetened beverages so that it can be used to treat NCDs? And some people came up with that policy. Some are even trying to develop a regulation now, but it will not work because of the food industry fight. We also see NGOs. We have over 400 CSOs in this country, all of them struggling for malnutrition, but they are all doing the same thing. They're not coming back to say, let's join hands to target one particular thing, because they're looking for space. And that is causing the biggest problem, because there is a power struggle, including UN. You'll find UNICEF the same. They're only targeting what they want. You'll find Kndi the same. They're targeting what they want, but they cannot come together. Now, the essence here is that it is only present to carry the agenda of someone, but there is nothing that they're doing at all for malnutrition. Why am I bringing all these things? The question, what role does Kenyan government have in tackling the triple burden of malnutrition? Madam Veronica, this one is my statement for you and I, what we need to push. Kenya is classified as a middle-income country based on gross national income, GNI, per capita. Now we have moved from low income, an indicator of productivity. It is a public knowledge that economic growth is expected to contribute to the well-being of the population, which in turn leads to improved health and well-being. This translates to improved nutritional outcome for children and even for adults. However, this would be much affected by equitable distribution. Now, equitable distribution of benefits across the population. You cannot compare those living in Nairobi with those living in ASAL areas. This may lead to disparities most of the time, and we know very well that that disparity is chronic and it is politicized. There is much evidence that Kenya has made good progress in tackling malnutrition, and I think, Madam Veronica, that is a plus. I remember we got something that was close to an award. And I also know that there are many programs that have come in, and we have over 400 CSOs in this country. The question is, are CSO improving nutrition, or they're making more people more poor than they found them? If you give me a cash to go and access some services, if I don't produce cash, more cash, are you sure that I will continue? What about sustainability? You can't give cash forever. There must be a mechanism for sustainability. And that is why they will come, they give money, and after they have given money, they go back, and people go back to deterioration again. So, in conclusion, we are saying the government of Kenya should start thinking of direct funding for nutrition other than depending on partners. Because a partner will force us to align to their objectives. While government should know that if they invest more in nutrition, then they will save 6.9 of the gross domestic product. And that means we must lobby as nutritionists to tell government, or including parliament, that nutrition is a solution for poverty and also declining economic growth. Therefore, they have to invest. How do they invest? Now, we are saying the most effective solution to the triple burden is the food system approach. This would include transforming food system by improving food quality, strict regulations on processed food, and strict regulations on unwarranted marketing of dangerous food products for our children. I'm not just talking about breastfeeding. I'm also talking about complementary feeding, because some of them are very dangerous for our children. Now, deployment of nutritionists. We have over 15,000 nutritionists in the country now. only 3,000 are employed. We are training students, they are all here, but nobody takes charge of that. Now, when you tell them about nutritionists, they ask what is their value. When you tell them the value and you indicate that they are ignorant, I remember telling a particular group of leaders that this is ignorance of the highest order. They said, I'm abusing them. But ignorance means you don't have knowledge in that area. And it is because, one, we are not balancing the leadership to include nutritionists and others in decision-making in this country. And so we are leaving it for the medical doctors or physicians to make a decision on behalf of nutrition. That cannot work. Transforming food system, therefore, will help us. And how is this going to happen? We must strengthen regulatory framework so that the high-calorie rich foods that we have in the supermarket, the ultra-processed ones, are properly regulated. And nutritionists must be brought on board in the HRH in government, that is Human Resource for Health, as a core cadre, not just others. Not just others, because we have had many times, even if the PS medical, and then a physician, and then a pharmacist,